Hello, my name is Dr. Zubin Dev Sharma, and I'm a senior consultant gastroenterologist at Fortis Memorial Research Institute, Gurgaon. And my area of expertise is predominantly luminal and neurogastroenterology. This is a specialty that deals with those disorders which pertain to the motility issues of our intestines. Diseases like chronic constipation, diseases like reflux disease, diseases like irritable bowel syndrome, and many more. And my experience with these disorders for last close to 12 years is one of the commonest issues that our patients are suffering from, and it's a pretty common issue at a population level also. Commonest complaint that patients come to me with is chronic constipation. So chronic constipation is something which forms the majority of my patients' complaints. When they say chronic constipation, we usually want to understand that what they understand or what they mean when they are complaining of constipation. So one has to understand that in India, because we are such a big country and different meanings take place to a single word constipation. Patients can complain of abdominal pain, bloating, feeling of incomplete evacuation, hard stools, sometimes not passing stools for days together. All these complaints tend to be, under the umbrella term of constipation. So patients usually come to me with all these complaints, or sometimes they will just say, okay, I have constipation. And as a doctor, we have to try to break that into different parts and understand that when they say constipation, what exactly do they mean, or what is their understanding of the word constipation, and what are they trying to tell us when they say that they have constipation. That's a very, very pertinent question. So, chronic constipation is something which, as I said, can mean different things to different people. Whereas when we come on to a specific kind of constipation, in fact, it's the commonest kind of constipation that we are dealing with, and that is usually called as dyssynergic defecation. So chronic constipation in simple language means any constipation which has been there for months together, and in some cases for years and years together. And 60 to 70% of my practice of patients who come to me with chronic constipations are the one who actually have dyssynergic defecation. The other type is the slow transit one. So how do we really make it simple for a patient to understand? When we say slow transit, we simply means that the movements of the intestines are slow, and it is pan-GI. That means that the small intestine is also moving slowly and the colon is also moving slowly. And when we say that that's dyssynergic defecation, one has to understand is that this term only is talking about the last act of passing stools, that is actual process of letting the stool out of the intestine, the defecation process itself, and that is dyssynergic, means that it is not working in synergy with each other. So the movements are fine, but when it comes to the last process of getting the stool out, that is where the problem lies, and that actually is the commonest reason for somebody who is complaining of chronic constipation. When we are talking about constipation, it really is very, very important that they understand that what is the reason behind that particular patient's constipation. So, just giving laxatives or just loading them up with drugs is not really an answer. We have to understand that all chronic constipations are not really the same. Chronic constipation can mean different things, and just giving them or loading them up with different kinds of laxatives, changing laxatives one after the other for months together is not really an answer. And dyssynergic defecation is a kind of constipation which totally has a different treatment than just laxatives. And now, even if you look into the data, you look into the scientific literature, you look into the various guidelines that have come from across the world, including Indian guidelines, This is a kind of defecation difficulty or constipation which actually responds to a different kind of therapies rather than laxatives. So I think it is very, very important that people understand that what dyssynergic defecation really means, how do we diagnose it, how do we handle that, and not just keep on taking over-the-counter drugs for years and years together. And when they come to us, so much has changed in their intestines that it becomes really difficult to manage their constipation then. So the problem is that we are not really identifying them enough because we are not really testing the patients enough. If you talk of my practice, because we do get those patients who have already been for years and years suffering from the disease, is that we test them, and when we test them, we pick them up. So if you end up testing all of the patients, you will realize that almost 60% of these patients actually have dyssynergic defecation and not really the other way around. The earlier studies and some of the studies from India itself, they actually said that the slow transit ones are more common. That is simply because they were not testing them enough in numbers. But yes, as the awareness is increasing, as the understanding that there is a treatment possible for it, I think we are picking more and more dyssynergic defecation in our practice. So there have been a lot of good studies from across the country on only chronic constipation. They haven't really tried to differentiate what kind of constipation we are dealing with, because these studies are pretty old. There's nothing really, no recent ones which have come up. And close to 25 to 40% of our population, which is a huge number, and this 25% becomes itself a huge number, actually suffers from constipation. And then we also have to see one more important aspect is sometimes it is also a perceived constipation, that, okay, I feel that I'm constipated, but we don't really fit into that definition of constipation. And that's another challenge. You have to understand that we don't know, or we are not really sure what really truly defines a constipation. If we go by the Western literature, if we go by the American and the European standards, anything, more than passing motions twice or thrice in a week is good enough. But in India, we really know that that's not how we pass stools, and if we don't pass stools every day, and if we are missing out even a single one, we tend to become constipated. So for us, I think the Indian Society of Gastroenterology has really brought out those guidelines, and I think they differ from what is there in Europe and West. So for us, chronic constipation is really a big problem at a population level. And it's good that the societies are really coming up with some guidelines now, but it really has a big lacune as far as testing is concerned. So usually this is not something that you are born with, although this disease can also, in fact, it's one of the common reasons in childhood constipation also. It's kind of an acquired behavior to a stimulus or to any kind of a painful process in the past. It usually begins with an episode, but over years it tends to become an acquired behavior, and it's like a bad habit. You really are not using the muscles in a proper way. When we say the word dyssynergy, it simply means that it's not in synergy, it's not in a balance. What are we talking about? We're talking about the muscles. So the muscles which are required to push the stool out versus the muscle which needs to be relaxed for the stool to come out, those are not really working in a synergical manner. And this is usually an acquired behavior. So it's not something you are born with. It is usually an acquired thing, but this acquisition of this bad habit can happen at any age. I think the commonest thing that you will start feeling is a feeling of an incomplete evacuation. That simply means is that I have passed my stool, but I am not satisfied. I still feel that something is still left inside. I'll again go after some time. I will again try to put some pressure. Second symptom would be that the excessive straining while we are trying to pass. That means that we used to not feel so difficult while passing earlier. Now I have to exert some extra pressure. feeling of something getting obstructed in the anal canal is the third thing. Forcing, in difficult cases and sometimes in advanced cases, patients also tend to use their fingers, or nowadays the water jet that we commonly get, and we try to put some water inside and try to get more and more stool out. So these are the 4 or 5 major things that patient tends to start doing first as a bad habit, and then they keep on doing it, believing that it's in a healthier way. And this is what actually starts the whole process or creating that abnormalities in the muscle. And this is, if anyone is doing all these things, then they are probably on their way to developing dyssynergic defecation. So the diagnosis is not really very uncomfortable. In fact, it's one of the pain-free procedures that we do in endoscopy. It's again an OPD test. And we do have to pass a small balloon, lubricated with jelly, of course, in the anal canal, and try to see the pressure. So it's not really very uncomfortable. It's more in the mind that something is going in the anal canal, but it's not a painful or uncomfortable procedure at all. So all GI disorders, whether they are constipation, they are other ones like IBD or IBS, all of them are affected by the amount of stress or the amount of psychological issues that we are dealing with. And particularly if we talk of motility disorders or disorders which are dealing with the movements of the intestines, like irritable bowel syndrome or chronic constipation or reflux disease, they are definitely going to be affected by the amount of stress that we are dealing with. So one has to understand that the GI tract is kind of a second brain for you. There are same number of neurons and nerve endings in our brain and spinal cord as well as in our intestines. Exactly the same. And our intestines, they perceive our stress and they will respond to it. For example, if you are stressed out, how will your brain behave? You might feel sleepy, or some of the patients might feel to have a total lack of sleep. You will have a heavy head, sometimes even a headache that can trigger migraines. But how will your intestines react to the same stress? Some of the patients tend to develop diarrhea. A lot of students just before the exam, or a lot of people just before an interview will have a slight urge to pass stools. Some of the ones will actually develop constipation. So stress actually makes your intestines respond. And if you are in a stressful job or a stressful personal issues over a long period of time, all this stress tends to accumulate. And when this accumulation happens, you will end up with various issues with the GI tract, particularly dealing with constipation and IBS. So the best way, and in fact the way which should be done to treat dyssynergic defecation is something called as a biofeedback therapy. Now biofeedback, if I break it down for a simple language, is feedback on a biological process. That means that while you are doing that biological process or enacting that biological process like defecation, we will give, or the equipment will give you a feedback. That feedback can be in the terms of a visual feedback, that we actually show you how you are generating pressures using the muscles. It can be in other ways around. So this biofeedback therapy is something which is the simplest therapy, and it's completely risk-free, has no side effects. But that's a level A best grade evidence for treatment for dyssynergic defecation across the world in the guidelines. It is even better than giving laxatives, because laxatives can be used for a short-term period. It certainly cannot be used for a long-term period. Certainly, when we do a biofeedback therapy, we in fact are talking about complete overhauling of a patient's lifestyle. We have to understand where is he coming from, what kind of diet that he takes, what kind of profession he is in, whether he has a sitting job or a standing job, or he is physically active or not, what kind of washrooms they are having in their homes, how the overall their a whole day actually goes on. So that's the first day of biofeedback, we tend to analyze their lifestyle itself. And wherever we feel that some lifestyle modifications can be done or are required in a patient's life, then we certainly recommend. Some of the simpler ones include increasing the water content in your food, because if you don't take enough or consume enough water, your stool will tend to become harder. If you find in your diet you don't have enough fiber content, we tend to increase that by various means, either via dietary means or by a medicinal or a pharmacological means. We also look at your habits like smoking or alcohol. We look into your habits, how you actually pass the motions, whether you use an Indian way of a washroom or a WAC, or you use a Western toilet. In Western toilets, we tend to tell them that, okay, you can sit in this particular posture, which may help you. So it actually encompasses dealing with your whole lifestyle and trying to improve that lifestyle to a level where it slowly improves your overall process.